Well, with women, the biggest cause of not getting pregnant is probably due to not ovulating, and one of the common causes here would be polycystic ovary syndrome or polycystic ovary disease. Now this is a condition where you can have a number of little cysts on the ovaries, infrequent periods, not ovulating very often, and having an increase in male hormone levels, and these come from the ovaries. You may have an increase in facial and body hair. We have good treatments for this, of course. Initially just weight loss and exercise. Sometimes it's a matter of just taking some oral medication such as clomiphene to make ovulation happen. Sometimes it's injections with hormones, and at other times we need to go to assisted reproduction, thinking of techniques like IVF. The other big group of causes for anovulation is just maternal age. I mean, as you get older, you have less eggs in reserve. So my advice is always, if you're planning a pregnancy, please think about it, trying about it sooner rather than later. There's another big group which involves endometriosis. Now, endometriosis is a condition where the lining of the womb is found in places where it's not supposed to be. For example, on the ovaries, on the tubes, on the bowel. Now, this can cause pain, but it can also cause infertility because the endometriosis tissue is quite toxic to ovaries, it's toxic to eggs, toxic to sperm, and toxic to embryos. So the sorts of complaints that women with endometriosis may have would be very painful periods, pain with intercourse, pain with bowel motions. The only way we have of diagnosing this reliably is by popping a telescope in through the navel and removing endometriosis, and this is successful about 70% of the time. There are other treatments as well, ranging from hormones all the way through to IVF as well. Other factors include tubal factors, where the tubes might be obstructed by inflammatory or infective conditions. There are other conditions such as abnormalities in the shape of the uterus, septa in the uterus, even fibroids can interfere with women getting pregnant. So there's a fairly long list of things that can be there, and that's why we suggest coming along after trying for 12 months, and we do a few investigations to find a cause.